Alberta may be lagging behind when it comes to screening age for breast cancer. Here, women start screening at 45. But last week, the Canadian Cancer Society changed its recommendations, saying 40 needs to be the age women start regular screening. What difference does a 5 year delay make when it comes to breast cancer screening?
A new study came out this year that's showing the rate of breast cancer is increasing as early as in the 20s for Canadian women. So it's a local uh, study based on Canadian data. We often think about breast lesions in younger women as being benign, and statistically they are, but there are more cancers out there and they're more aggressive in young women.
Now, Sundas, you were 29 when you were diagnosed. How easy was it for you to get screening leading up to that diagnosis?
It wasn't easy. When I found a lump in my breast, I had to go to my GP and express my concern. And it took a bit of a back and forth for me to convince him that I needed to get screening done. Unfortunately, since I was young, I had desperate breast tissues, so I had to go for an ultrasound and a mammogram. Another setback or barrier, you can say, is because I live in Fort McMurray. It's considered rural Alberta, and I had to travel to Edmonton for my screening. That is the reason why I'm here, because I advocated for myself. I made sure that I got that screening done, and I got diagnosed and got this disease catched at a really early age. And it really changed the trajectory of my cancer journey. If I had waited for, I don't know, a couple of months or maybe a year to get the screening done, I would have a different outcome.
There's a lot of misinformation out there about breast cancer screening, and it impacts women's ability to advocate for themselves. And it also leads to confusion for physicians.
Do you think doctors need to be more aware of all these sort of things? And this is part of why you're speaking out about it?
One of the reasons why guidelines will recommend a later start in screening for women is fear of false positives or overdiagnosis. And it's cheaper for the healthcare system too. Right now we're talking about, an individual woman, but it makes sense on a healthcare system basis as well to screen earlier. And certainly to listen to a woman who comes in and has noticed a change in her breasts. I think it's a good motto for us as physicians, even if we think statistically that a lesion is going to be benign. Every new breast lump deserves imaging.